Hello, my name is Alexis Webb. I'm a physical therapist here at the University Hospital. First, we'll go over what the definition of physical therapy is for those that are unaware. Physical therapists are here to restore a patient back to their most optimal level of function and to help them be as independent as possible. We are here Monday through Sunday, well, all week, and we usually come see patients twice a day, once in the morning and once in the afternoon. We are usually here from 8:30 to 5, and we take lunch from 12:30 to 1:30 if you all are interested. We have no set time, and when we come visit patients and do treatments, it's all based on when patients are available and when we can actually get to them, but we will see you twice a day. For the hip and knee replacements, the patients that have those, there are weight-bearing precautions for each, for the knees and for hips. So for people that have a knee replacement, you will be weight-bearing as tolerated, which means you can put as much weight on your leg as you like based on your pain. And for the people that have hip replacements, it varies based on what kind of surgery you have and who your doctor is. So it could be touchdown weight bearing, which is just like 10% of your weight, partial weight bearing, which is 50% of your weight, and you have some that do weight bearing as tolerated as well, which is as much weight you can bear on your leg. For patients that have knee replacements, they usually are here about 2 days. If patients that are having a hip replacement have to go to a nursing home, they usually have to get a PPD, which is a TB skin test, and it usually takes an extra day to be able to read that, so that's why you'll be here until the 3rd day, which is post-op day 2. And thank you very much for supporting the physical therapy at University Hospital, and I look forward to seeing you soon. All right, we have Bill here with us. He's volunteering to be our patient for the video. Bill has had a knee replacement done 2 years ago and another knee replacement done 1 year ago. Okay, so now we're going to start on doing some exercises that the patient that comes in for a knee replacement will do. The first one we're going to do is what we call a heel slide, and it's pretty much just bending your knee. So you're going to bend up and down, and it may vary based on the patient on how far you can bend your knee. So we'll just do it to your tolerance, and we'll do that about 10 times. And you can see I'm supporting your heel and the back of your knee so that I'll be able to help you and you won't have to do it on your own, okay? That's a heel slide. The second thing we're going to do is what we call a straight leg raise. If you can bend this knee for me. And you're going to pick this leg straight up off the bed. Good. And again, it may vary on how far you can pick your leg up. And this is good for helping keeping the knee straight, which is very important. All right. Okay. The next exercise that we're going to do is what we call knee extensions. So we're going to put this blue bolster underneath your knee, or it may be a pillow if you're in the room. And all you have to do is kick your knee straight, just like this. And this is also, this is also good for bending when you're here and for keeping your knee straight when you're at the top. So it's very important to try to get as much range as you can. All right, and one more. Good. So I'll support your leg here and move the bolster and lower you back down. The next exercise is what we call a quad set, and it may be difficult for you to see it on the tape, but what you have to do is you push your knee down into my hand back here, and as you can see, if you can see, it contracts. The muscle here contracts and makes the knee straight, which is also important, so when you're walking, you're not walking on a bent knee. So you hold it for about 5 seconds and relax, and then you push down again, as you can see. And relax, and push down, and relax, and push down again. Good. All right. Another important thing we need you to do, which are called ankle pumps, and several people will tell you this, but you need to just move your feet up and down while you're in the bed as much as you can. That's important to keep your blood flowing in your legs and to prevent you getting blood clots. Okay? Thank you. Now when it's time to get up, you're going to slide your leg that you did not have the replacement on off the bed. And I'll hold your leg you had your knee replaced on here. Now you're going to sit up and put your hands behind you and push yourself so you can scoot your bottom out to the edge here. And I'll support your leg until it reaches the floor. Okay? Then we'll have a rolling walker, which have 2 wheels on the front. And we have what we call a gait belt, which we'll put around you. And we hold on to you for safety. In case you lose your balance, we'll have something to grip. Okay? Walker goes here, one hand on the bed to push up so that's stable, because if you pull on the walker, it'll pull back on you and you may fall. So we want one hand on the bed and one on the walker, and you'll stand up. And we'll just walk. As you know, weight bearing is tolerated, so you'll do it based on your pain level, okay? And that'll be it. For the patients that have a hip replacement, we have to be very cautious of your hip precautions. You're not allowed to bend more than 70 degrees here at your hip, which is probably, if you're lying flat, it's going to be probably about like this. So we don't want to go much past that when we're doing our exercises. All right. You don't want your legs to be too close together. So we like that you'll have a pillow between your legs, and at all times we'll keep your legs apart. You don't want to twist your feet in and out, because that rotates here at your hip, and that's a precaution that we have as well. You don't want to cross your legs over like this, lying in bed or sitting up, because it's the same thing as bringing your legs too close together, okay? The first exercise we're going to do is called a heel slide, and you're going to bend your knee up within your precautions and back down. And it may vary per patient because of your pain level, okay? The next exercise we're going to do is called a straight leg raise. So you can bend this leg up, and you're going to lift this leg straight up in air, which is very difficult because most of your hip muscles are the ones that are controlling this motion. So most people need a lot of help with this exercise. And again, we're going to stay within your precautions there for your hip. Okay? You can let this one down. Our next exercise, I'm going to put this blue bolster underneath his knee. And for you, it may be a pillow if we're in the room to adapt to the equipment. Okay, so you're going to kick this knee straight. Good, and back down. And we also want to be careful here with the hip precaution as well, so we won't make this too high so you won't go past your precaution, which is 70 degrees, no more than 70 degrees when you're sitting up or bending. Okay, and one more. Good. And I'm going to support your leg and move the bolster. All right. Another exercise you're going to do is what we call a glute set, which pretty much is just squeezing your bottom together. And it may be hard to visualize, and relaxing. You're going to squeeze and hold for a few seconds and relax. And this is important. You can keep doing it. This is important because the muscles that are cut through to have your hip replaced insert here and insert around your bottom into your side of your hip here. So it's important to use that to help strengthen up those muscles. Okay? So we'll do those a few times. All right. And the last thing that is very important for you to do while you're in bed is called an ankle pump. And that's when you move your feet up and down. You can do both of them. Up and down. And this reduces the risk for getting a blood clot, so it keeps your blood circulating, okay? Do that as much as you can while you're in bed. Now that we're done with exercises, we're going to show you how we're going to get up from the bed and walk. Okay, so you're going to move your non-operated leg off of the bed, and I'll help support your operated leg to the side of the bed, and it may take a few steps to get you here. All right, but we want to remember to keep your knees apart because of your precaution, okay? Now you're going to lean forward and put your hands, push up from behind you with your hands. And you lean back kind of in your hands so that you won't go past your hip precautions here, 70 degrees. And you can just slide around and just use your arms and scoot your bottom to the side of the bed there. Good. And you're going to lean back into your hands to make sure you don't, there you go, and just scoot your bottom out. Slide it out. There you go. And I'm going to put your feet on the ground. This is a standard walker. There are no wheels, so it's easier to weight bear through it if you have touchdown weight bearing, which is not a lot of weight, or partial weight bearing. It's more stable to not have wheels on it. Okay? Now you have a gait belt, which we use for safety. If you lose your balance, we'll have something to hold on to. Now when you stand, it's really difficult, but you can't bend more than that 70 degrees, so it's important to try and remember that, okay? So you can reach up with either hand and hold your walker. Good. You can put your feet flat on the floor for me. And you're going to use your leg you did not have surgery on to really weight bear through, okay? And push with this hand. And you're going to stand straight up. All right. Okay, and now we're going to take a few steps here. Okay, next we're going to do stair training. So the rule of thumb is to go up with your good leg, which is the non-operative leg, and down with your bad leg, which is the leg you had operation on. So you're going to start up with your good leg. Step up. Good. All right. And you're going to turn around. We'll go back down. And when you're coming down, you're going to come down with your operated leg first. And that's it.